Okay, so today our first speaker will be Dr. Nadirah Babji. She's a medical doctor and humanitarian. So she's actually a medical graduate. She has not studied housemanship. It's been 2 years, I think.
Yeah.
3 years, yeah. So she has an extensive experience in volunteering in Cambodia, Malaysia, India, Nepal, Tanzania and Kenya. So it's really strange, the place I met her in was in Bangladesh. So I went there to volunteer under Mercy Malaysia as a doctor there. They had this humanitarian aid for the Rohingya refugees, and I met her there when we were doing medical supply runs. So yeah, so strange. And then after that, when I came back, I saw her in the climbing gym where I always am. So that's why she's here today. So she's been involved in a lot of relief efforts. So she'll be here to. She was awarded a scholarship to attend the health emergency in large population course in Johns Hopkins University. So now she's working as the regional community health officer with the International Federation of Red Cross and Red Crescent Society's Asia Pacific Regional Office in KL. So she will just share her experience on her journey.
Yeah.
Hi Nadirah, thanks for coming.
Thank you for inviting.
So just tell me about yourself as an individual.
So I'm always like I think if you were friend with me back in college or whatever, I'm always like that weird person that do things that nobody else do. I always go to places that none of my friends want to go, and at the end I'm just so tired of waiting everyone. I was like, whatever, I'm just gonna go anyway. So I end up like I always go to like weird rural places. I study in India, so I always go to rural places that none of my friends would want to go. And then they were like, what is that? Okay, and then go hiking, something like that. And my friend would want to go to Europe, want to go to Dubai. And then I end up having this passion for volunteering, because I think when I travel and volunteer, you get to go very deep into the community. You listen to their stories, you understand why certain thing doesn't work for certain people, you know. And then I start to like, okay, I want to do more. So I started going. I was traveling in Africa. I was staying in Africa. I was staying at a family in Maasai. I started teaching them some stuff, and I was volunteering at the girls' safe house, learning about female genital mutilation, which is really something quite new. And then after that, I was supposed to have this epic trip to Europe, and then I'm just stuck at Turkey at the end. Stayed there for a month, and then I was just volunteering for refugees. At that time, they were, there's a big fuss with refugee crossing the boat to Europe and whatnot. So I was one part of the relief worker that actually go and save people at the shore and saving boats and stuff. So I guess like a lot of I met some of my juniors when I came back to Malaysia, and they were like, oh yeah, that's so you. When I told them like, I was doing this, and like, so predictable, like so you. So I guess like it wasn't very weird for people who know me personally. Would be like, listen to like, oh, I was doing something very weird. They were like, oh yeah, you memang like that lah. You will do this kind of thing. So I guess it's not so surprising lah that I would go. Yeah.
So did you wanted to become a doctor, or?
I think I kind of always wanted to go a doctor. I always say I hate people, but I actually like people. But I think it's just like I said, I'm always someone who wants to do things that are weirder than the other people do. I don't like conventional way. I always want to do something like no other people would think about it. So I guess when I start going to Bangladesh and going to Europe, I start to see things that are, wow, okay. It's nice to volunteer. You go to rural kampong and help some local, but is it just there? Like, is it enough? Like, I always think like, why I go there? Why I choose this kampong? Like, Sarawak is such a big place. It's a huge community, right? Why only this part? Why only that part? Like, what is the rationale? Why are we doing dental care here but not medical care there? Or why? So I want to know these whys. So when I go to Mercy, when I was employed in Mercy Malaysia, and I start to learn like, oh, this is this and that, there's assessment, there's this, and then I start to think, oh, okay, so, and I think Bangladesh is the part, I mean, Greece is one thing.
Sorry. So you wanted to be a doctor? Or?
I do, but it's just like, I always want to like explore, like okay. When you work at hospital.
Why didn't you start housemanship?
I guess it's just like, okay, first I think when I started joining, when I was in Bangladesh, it really an eye-opening experience that there's all these humanitarian NGOs, is doctors and Doctor Without Borders, blah blah blah, and then it's really eye-opening. Like, oh, people do this, and they're all doctors. When you talk to them, they're like doctors, and then become epidemiologists, doctor become project managers and whatnot. And then I thought, like, okay, I have some experience there. Why don't I have one foot in? Why don't I just try for a couple of years instead of, because I feel like, okay, maybe this is my own perception that if I go to, I always have spot in the government, more or less, like they need housemanship because they can pay you cheap, right? Whatever. I mean, it's there. The spot is going to be there. There's always going to be needed doctors or whatever. But this kind of thing is so hard to get in. Like, at least for a Malaysian, people from developing countries, it's hard to get your foot in. You can't just like show up in Red Cross and like, oh, I want to work with Red Cross. They will have a certain limit of like how many experience you need, or you need to have, you need to demonstrate
so
that
how
you
did you start? Like, first thing, like you were saying when you were in medical school, like how did you start to put like one foot in?
So I did a lot of volunteering. So a lot, like I think it showed in the CV.
How did you find it?
Internet. You'd be surprised at what you see in the internet. I remember in final year, I spent 6 months surveying so many things over the internet where I can volunteer for a month in Kenya. It takes like, I study for final year, and then when I take break, I go online and check for like opportunities where to volunteer, which family. And I spent, I think, like I said, is the volunteering, when you put on your CV, then those kind of things you can put on CV, right? It's so much, it added so much value. It gives you a perception that, oh, you can survive in this area that nobody else can survive.
The first volunteer gig that you did?
I think it was, oh my God, I can't remember. Maybe it's somewhere in KL or very small, like homeless, blah, blah, blah. And then you start to go like to where in my study I used to become one of the student representative. We organized like a food drive around the community area, and then every time I go travel, I always like, oh, is there any place I can, some orphanage or something I can go or something. Then it just get there. Every single time I travel, I always look at, is there somewhere I can stay longer. It's nice. I like one of the trip I did in Darjeeling, India, in northern part of India, called place Darjeeling. Great for the teas, I swear God, it's good. There's a place, there's an orphanage, and I stay there, and the kids are so lovely, and you get to know them in a deeper level. Like, you know, they are telling their stories.
What do they expect of you? Like, how do you? Okay, let's say I want to volunteer.
Right.
So what do I do first? Like,
so for me is that see what skills you have. And I think this is also another thing. Like, don't lie what you like or you don't like. For example, I don't like teaching. So a lot of my friends like, oh, you can volunteer. You tak nak pergi mengajar some refugee kid. Like, I don't like teaching. Like, I mean, like, I cannot teach. Like, I don't want to lie to myself and like pretend just because I want to. I mean, of course I want to help people, but I really don't. I'm really bad at teaching. So don't lie about that things. Like, if you cannot teach, it's okay. And why would, if you yourself, you have a kid, you send to school with teacher with good degree, why would you let people, refugee or underprivileged kid, to have subpar level of teaching like you have, like you, right? You know, I can't teach, so I don't teach, so I don't do that kind of stuff. So I guess that part is to know what really you can offer, what you cannot offer. So once you get that, and then you try to look at opportunity. There's so many things online. Like, once you get in, and I mean, it depends also on people. Some people willing to spend money. There are some opportunity that you spend like 1,000 to Africa and stay, whatever. There's opportunity you don't have to pay. You just need to find and know how much money you have. If you can pay, it's better, because those kind of, I mean, it's not the best thing, but those kind of things you are better taken care of or whatever. But if you don't have money, like me, and then you go for like cheaper alternatives, and so there's always something that you can do. And then and don't do like a touch and go type of volunteering, like 5 days and then you balik. It doesn't really you don't understand the community, or you just like do something like so short that there's not much of impact. You can't feel anything, people don't even remember that you're there. Okay. So I guess try to stay long and understand. And then sometimes maybe you say, oh, I want to help, you know, you want to do like dental, whatever. Then when you sit down with them a couple of weeks, and you're like, oh, actually they already have a good hygiene practice. Maybe they need something else, or maybe they need menstrual hygiene, you know, awareness or something like that. So you start to understand them better, the community better, and maybe you can serve them better in that way.
Okay, so what's the like career prospect for like this kind of field, the humanitarian field? Like what? Okay, I go in and I become a volunteer, and then what next? Like,
Okay.
how do I make a career out of it?
Right. So once you have a significant level of experience, I think is that once there's a job opening or whatever, or you can intern. So sorry. So I start as once I get back, and actually like I would say I in a good position, but I've done some level of like I wouldn't say high level, but managerial position at in Bangladesh. But when I go back to Malaysia, I was like, okay, maybe I'll be happy to start somewhere, but maybe I feel like I need to learn more. So I go back to Red Cross and I intern. Even after a year, I would say almost a year, I am a coordinator in Bangladesh. So I go back down and I intern. So I learn in some weird department. There's a department called like Planning, Monitoring, Evaluation, Reporting. And just for a record, I study in India. And in India, we don't learn how to write theses. We don't do research work. I don't know if it's same in Malaysia if you guys graduate, but medical doctors are so shit at this kind of stuff, right? I'm telling you, we don't learn these things, right? So I think when I go to this PMER, we call it PMER department, where we write reports, evaluate the data and whatnot, I was like, what is this? It's literally like learning things from scratch. Nothing that I know of. But I interned there for 6 months, and then I start going to and then people from the health department start to notice me, and they're like, oh, why don't you come to the health department? So I moved to extend my internship to the health department, and then at the end they were like, oh, why don't you work with us? They would see that. And I think in some organization, you can actually they open position, or maybe you can just ask like, oh, I'm a doctor. Maybe you can approach someone in Mercy and say, I'm a doctor, I'm interested to do this kind of job, is there any position open for me? So there might be something. You just need to know where to look for and know to what you can and how far you're willing to push for it, because the work for me is not I wouldn't say it's easy, but it's not so bad, but it's not so easy either. You have to read things on like, do you ever read on health and climate change? That's like literally what I've been doing for the past 1-2 weeks, is reading about health and climate change. I would never in my life think about reading about it. And I have to do this. I was telling to Selena, like part of my job is also to do with the coronavirus. I have to read a whole thing about international health regulations. Like, it's not...
Okay, so let's say I go into humanitarian, like what kind of positions can I apply for?
So it depends on, usually as, like now I do like community-based work. And then if you more technical, I think I've seen people who work with the UN as project managers, someone like project managers, or when in John Hopkins, they one of my professor, he did a clinical epidemiologist, and he set up a epidemiology system for some countries and whatnot. It's just a matter of like going to these workshops and stuff, and you start to say like, oh, he do that, and some even people who do, because in Malaysia, public has very medical spec. If you go to a country like Indonesia, public health is a separate, I would say bachelor or whatever, separate, I would say discipline on its own, right? And in Malaysia, it's not like that. You have to take medical and then you have to take public health. In Indonesia, it's separate. If you go to Indonesia, I was very impressed about how good their public health is. I went to a study in Kampong, somewhere in Indonesia, talking to one of the villagers about family planning. I swear to God, the entire people in the village know family planning. You can ask them, give me 5 examples of family planning. They will list down every single thing for you. And I would say people in my flat won't even know, in KL, my flat in Sunway, okay? No, I would say I can pick a random house and I say, oh, tell me family planning. Nobody would know. So I was so impressed the amount of outreach they have done, which is, I think in Malaysia, it was not there, because we're so medical based. And the other day I have a talk with my friend who do something about the orang asli and how they claim that they were not consented to sterilization or whatnot. I think there's a bit of a fuss, right? And I was talking to my friend think it's okay. Whatever lah, this orang asli, we need to control the population, let's just do it. I can't imagine like, oh my God, you're doctor kot. this is like human right violation. So they think it's okay. We don't, in Indonesia there's so much like public health, they're so thoughtful.
So I think a lot of people will be asking like, okay, if I go into this humanitarian work, like how much my salary can I expect? I mean, you need to sustain yourself, right?
Okay, in general, it depends. So there's a national position, there's an expat position. National position, I would say beginning salary somewhere around 5,000 to 6,000. And if you go for outstation, if you do, sometimes I was sent to go to Afghanistan lah, you go to Myanmar lah, whatever. You get per diem on top of that. If you go for, you conduct training or you have to do monitoring visit or something like that, you get per diem on top of that. So it basic will be 5,000 and 6,000, and then it goes up to like 6, 7 if you do a lot of missions. And if you are in expat, so when I was in Bangladesh, I worked with Mercy for a while and then I moved to an international NGO. My basic salary was like 3,500 USD because it you know, they have to be prorate, right? For all, everyone have to be equal. So I get like US salary. If you do it UN, you will get like houses, you get all these benefits, and on top of that, your salary will come around maybe 4,000-ish US. Depends on which country, because if you're sent to a country like Afghanistan, you get hardship allowance. So the salary can come to 4,000, 5,000 US dollar.
Okay, is it difficult for me to get into all this stuff?
In a way, yes. I mean, UN is hard to get in. That's why I said like I want to put my foot in and invest some time, and then maybe I can like go around clinical and non-clinical. I don't know.
So I applied to go to be a UN doctor, and 2 years later they still haven't.
Yeah, it's really hard. It's true. It's really hard.
So like how can I prepare myself so that I can get a chance?
So I guess like a lot of UN. I think UN. You have to imagine, right? In all part of the world, let's say everyone is competing for that spot, right? Let's say, but in Europe, country like in Western country, they all have a master, which is quite annoying. But they all have a master. They go, so their CV looks better, and in their master program, their university invests in them to do some training with UNICEF or whatever. So compared to us, Malaysian, I mean, I would say some of you might not even know what UNICEF do. Like, you know what I'm saying? Like, people are not exposed to this kind of experience. So when you have this, at this point, you can see that people from the Western world are more at 1 foot or 2 foot steps, so like more advantage.
Like, number one, what
I would say like try to volunteer as much as you can, and then I guess equip yourself with all the technicals. Let's say if you work with infectious disease and whatnot, and then you can let's say you work in infectious disease and build that career like 4 or 5 years, and then you can show that during in your CV that
like,
I've done.
Should I take a paper, or how do I build onto that?
So I would say when you need to do more. I would say in UN, a lot of the portion of the work is to work with the local government and whatnot. So if you can establish a way, first like maybe like write a research paper, you know, make you look like very academician and whatnot, and make yourself have a technical expertise. Like you've done this work, I'm part. I mean, you might have a small role in the coronavirus response, but you say like, I'm part of the coronavirus. Nobody know how big or small your role. It's just a matter of like how you twerk your CV, which I think also as a medical, we are not used to making good CV. I would bet 100%, like if I have 100 students to make a good CV, they would not know, because I have that. I was like, I never do CV, okay? I never have to push myself. But if you ask an MBA person, they can like, they do a tiny job, but they were like, the way they say it, like, whoa, they were like they were the head of group leader or whatever, but they only have a small portion work, right? Is that true, right?
And to sell themselves.
Exactly, but we as a doctor, we never do that. We just like put a random CD, the hospital will definitely take us. And I think that's what, because we never have to sell ourselves. It's always a job in the hospital, it's always a job in the clinic.
So which like, okay, so now for somebody who's really new and they want
right.
to, so can you like list like maybe 5 NGOs or 5?
Okay, I would say Mercy is a good start. Mercy, and if you're into women rights and violence, domestic abuse or something like that, there's an NGO called Women AIDS Organization. They're really good. They do domestic abuse and stuff. So Mercy is basically disaster response, and they do refugee work. And you can also look into maybe start as an intern or something with UNHCR or UNICEF. I think UNHCR have a big base in KL. And maybe there's a AIDS, what is it called? Malaysian AIDS or something, cancer or AIDS organization and whatnot. And there's also another one that I recently applied, but I didn't go to the. It's something to do with sexual reproductive health. Like I think a Malaysian sexual reproductive health NGO. I just need to Google that back. Those NGO. So when you get this small NGO, usually. So mandate for UN, the mandate is to work with local NGO or also to work with government. So this NGO, whatever they do, you can, I mean, maybe you don't learn as much when you go to an international NGO, but once you're comfortable with all this paperwork, technical stuff, and then after a while you can definitely go to UN level. It's just a matter of like, because I think nowadays there's a shift of humanitarian perspective from hiring more expats, but to invest more in a local talent. If you see in Facebook now, there's so many Doctor Without Borders trying to recruit Malaysian. They do that recruitment drive or whatever, because back then it used to be like these white people coming to Indonesia and then.
So do you know of any like recruitment right now?
I'm not sure. I mean, in terms of in NGO wise, I'm not sure if there's any. But I think I saw sometimes like Doctor Without Borders usually take a recruitment drive. Maybe they take GP or something to go around, because now, like I say, there's a shift of localization. Who would know better about Asia more than Asian people? You don't want to fly another doctor from America to come to you, because there's a lot of issue with that. You fly doctors to a third world country, all the cost is equivalent to paying a doctor in that country itself. And also they don't understand the cultural context, they don't understand the sensitivities. So at the end, the shift is like to have more local doctors. So I guess Malaysia is quite a good start for them, maybe to recruit and whatnot. So I've since start seeing like a lot of recruitment drive from MSF nowadays.
Okay, so have you had any stigma? Like you came back, you haven't started your housemanship?
So much. Even my mom was like, "Are you even a doctor?" My mom would ask me that, and sometimes people were like, "Are you volunteering?" I'm like, "No, it's a career." I'm like, people thought like I work for free, and I'm like, no, I actually earn quite well. Like I'm not like volunteering my free time and work right across. No, that's not how it works. And sometimes people are like, are you even working? You always go around and jalan-jalan. And it's like, it's no, I go for work, but on a free time. Of course, like in your social media, you show like street of Yangon, but actually behind. There's only a photo, okay? The one behind I was teaching in class, and of course I cannot show.
So would it be a good opportunity to like travel and work?
It's yes and no. I mean, because at first, when I first getting mission, I think it was in Bangkok or something. I was so tired of Bangkok. But when you first start going to Bangkok, at the time it was like, oh, I got to go work trips and whatnot. It sounds like very fancy. It sounds fun lah. And then of course, because some of the NGO, they have, because they insure you, right, to go travel. At the same time, they have to take care of you. They certain level of safety, and we usually follow UN safety guideline. So they cannot put you in like cheapo hotel. It have to be at security level. So all those hotel with security level, of course, like at least 3-star and above lah, which I would never in my life would stay.
So like you can travel.
You can get good hotel. Why not? Like it feels fancy, but at the same time, you also have to answer your emails when you travel. You have to conduct a conference, or you have to do. At first it sounds fun, but at the same time all this work that piling up because of your travel, and you still have to keep up with it. It doesn't look very fancy. But otherwise it's fun. It's fun to, when I mentioned you guys about a trip I did in Indonesia where I go to this kampong. It's really an eye-opening experience. You get to learn about, because my work a lot with the communities. It's nice to see how community differs from each other. Even in Malaysia, a community in KL might not be the same community in Kelantan. And to understand that, like, what are the vulnerabilities and what are the needs and stuff, is for me it's very interesting. I don't know about like if people into it, yeah.
Any of you have anything to ask her? I mean, anyone interested in getting into humanitarian?
When you first volunteered, right?
Yeah.
You don't have clinical experience.
Yeah.
When you do housemanship, is there like a lot of limits on what you can do as a volunteer?
Yeah, it's a good question. So when like I said in the beginning, is to know what you can do and what you can offer and what you cannot offer. Some people, I mean, for me, when I first I started like, okay, this is thing I cannot do, and I always like be real about, don't like, oh, I think there's a lot of cases you can check online. There's people from US coming to Liberia and then suddenly set up a medical clinic, you know, like they're lying to yourself and you're also lying to the community that you serve. So when I first started, I always like, I only do like first aid, health awareness, like, you know, show some teeth and then teach, you know, teach kids how to brush their teeth lah, and then teach them how to you know, take care of themselves, like drink water, and you know, like all those tiny work. It does look macam like nothing else, but when things happen, it's so one of the things that I did in Africa is that we teach first aid, you know, basic wound care and whatnot, and it's so I mean, it doesn't look so obvious, like, oh, maybe it doesn't give impact, whatever. And a kid come to me and show like, oh, I just wrap my own leg like this, like how you teach. I'm like, oh, that's good, like somebody is actually using the thing that I teach them, so it's not so bad. It wasn't, I mean, but be real about what you can do or what you really like to do or you don't like. I just think some people are like, they like to want to do more because it looks sexy. Maybe you can post it on Instagram, but at the same time, think about people that you serve. Like, don't lie. Don't, you know, like.
Thanks a lot. Thanks
Thank
for
you.
sharing.